Good morning to all. My name is Aarti and my roll number is 50. I am a student of BSc Chemistry Honours final year. This is an audio lecture for the visually impaired students on the topic of types of drugs. First, antacids. Overproduction of hydrochloric acid in the stomach causes irritation and pain. In severe cases, ulcers are produced in the stomach. Until 1970, only treatment of acidity was by taking antacids. The substances which neutralize the excess acids and raise the pH to an appropriate level in stomach are called antacids. The most commonly used antacids are weak bases such as sodium bicarbonate, magnesium hydroxide, magnesium carbonate, magnesium trisilicate, aluminum hydroxide gel, and aluminum phosphate. However, excessive bicarbonate can make the stomach alkaline and trigger the production of even more acid. Therefore, metal hydroxides are better alternative because these being insoluble do not increase the pH above neutrality. However, these treatments control only symptoms and not the cause. Consequently, with these metal salts, the patient can be treated only temporarily but not permanently. In advanced stages, ulcers become life threatening, and its only treatment is removal of the affected part of the stomach. A major breakthrough in the treatment of hyperacidity came through the discovery that histamine stimulates the secretion of pepsin and hydrochloric acid. Therefore, the drug cimetidine was designed to prevent the interaction of histamine with a receptor present in the stomach wall. As a result, less hydrochloric acid is released and the cause of hyperacidity is cured and controlled. The importance of cimetidine was so much that it remained the largest selling drug in the world until ranitidine, also called as Genentech, was discovered. Now, antihistamines. It has been observed that some persons are hypersensitive towards certain medicines like penicillin, sulfa drug, etc. And other may be hypersensitive to dust, pollen grains, cat fur, particular type of food or fabric. This hypersensitivity of some person to some drugs, dust, pollen grains, cat fur, a particular type of food or fabric, etc. is called allergy and is due to the release of a substance called histamine in the body. Histamine is a potent vasodilator. It has various functions. It contracts the smooth muscles in the bronchi and gut and relaxes other muscles such as those present in the walls of fine blood vessels. As a result, histamine causes allergy, that is skin rashes, inflammation of tissue, asthma, and itching of hives. It also causes nasal congestion associated with common cold and allergic response to pollen. The drug which interfere with the natural action of histamine by competing with histamine for binding sites of receptor where histamine exerts its effect are called antihistamines or anti-allergic drugs. These are widely used for treatment of hay fever, inflammation of conjunctiva of eye, sensational rhinitis, that is inflammation of nasal mucosa, that is sneezing, nasal discharge, itching of eyes, nose, and throat motion sickness, nausea in pregnancy and post-operative vomiting. The antihistamine drugs which are widely used are bromopheniramine and terfenadine. Some other antihistamine drugs which are commonly used are diphenylhydramine, cetrazine, chlorpheniramine, promethazine, etc. The structure of some are here also described. After that, the neurologically active drugs. Tranquilizers and analgesics are neurologically active drugs. They affect the message transfer mechanism from nerve to receptor. Tranquilizers, drugs which are used for the treatment of stress, fatigue, mild and severe mental disease are called tranquilizers. They relieve anxiety, stress, irritability, or excitement by inducing a sense of well being. They are also essential components of sleeping pills. Tranquilizers are of many types and they work by different mechanisms. For example, noradrenaline is one of the several neurotransmitters which play an important role in mood changes. If the level of non-adrenaline in the body is low for some reasons, then the message transfer process becomes slow and person suffers from depression. In such cases, antidepressant drugs are used. These drugs inhibit this enzyme which catalyzes the degradation of non-adrenaline. If the enzyme is inhibited, then the neurotransmitter non-adrenaline is slowly metabolized and can thus activate the receptor for longer periods, thereby counteracting the effect of depression. In other words, depression is reduced. Quinine is used in controlling depression and hypertension. Some other substances used as tranquilizers are Valium, serotonin, etc. Barbituric acid and its 5,5-disubstituted derivatives such as veronal, luminol, saconal, amytal, etc. constitute an important class of tranquilizers called barbiturates. They are used as hypnotics, that is sleeping producing agents. After that, analgesics, neurologically active drugs, which reduces or abolish pain without causing impairment or reduction of consciousness, mental confusion, incoordination, or paralysis, or some other disturbance or disorder of nervous system are called analgesics. These are classified into following two categories. Number one, non-narcotics, also called as non-addictive, and the second one is narcotics, also called as addictive drugs. Non-narcotics, aspirin and paracetamol are the most important example of non-additive analgesics. Aspirin inhibits the synthesis of compound known as prostaglandins, which stimulate inflammation in the tissue and cause pain. These drugs are quite effective in relieving skeletal pain such as that due to arthritis. Besides these drugs have many other effects such as reducing fever and preventing blood pellets coagulation. Nowadays, because of its anti-blood clotting action, aspirin is widely used to prevent heart attacks. And drawbacks of this are, despite its popularity, aspirin is supposed to be toxic to liver. It also acts as a gastric irritant because it gets hydrolyzed to salicylic acid in stomach, which produces ulcer and sometimes causes bleeding from the stomach wall. Therefore, overdoses and its use on empty stomach should be avoided. Because of these defects, other analgesics like naproxen, ibuprofen, sodium or potassium are currently being used. In spite of these drawbacks, aspirin is still the drug of choice for prevention of heart attacks and reliever of angina pains. After that, narcotics or addictive analgesics. Drugs which, when administered in small doses, relieve pain and produce sleep are called narcotics. However, in large doses, they produce stupor, coma, convulsions, and may ultimately cause death. Most of these are obtained from opium poppy and hence are called opiates. Opium contains alkaloids like morphine and codeine, which are very effective analgesics. Morphine diacetate, commonly known as heroin, is the most widely used analgesics. These are chiefly used for the relief of post-operative pain, cardiac pain, and pains of terminal cancer and in childbirth. However, these alkaloids are known to be habit forming, therefore, to guard against addiction and misuse, these alkaloids are not sold without proper prescription. After that, antimicrobial drugs. Drugs which are used to cure disease caused by microorganisms such as bacteria, viruses, fungi are called antimicrobial drugs. These includes antimicrobials, antifungal, antiviral agents. Control of microbial disease. All antimicrobial control the microbial disease in the following ways: by using a bactericidal drug, that is a drug which kills the organism in the body; by using a bacteriostatic drug, that is a drug which inhibit or arrest the growth of organisms; by increasing immunity and resistance of the body to infections. Some important antibacterial drugs are antibiotics and sulfa drugs. Antibiotics are the class of drugs used as antimicrobials. These are chemical substances which are produced by some microorganisms and can be used to either inhibit the growth or even kill other microorganisms which cause infections. Thus, antibiotic therapy is like using one thief against another, but development of synthetic methods over the recent past, however, have resulted in the modification of this definition. Antibiotics are now classified as chemical substances which is which in low concentration either kill or inhibit the growth of microorganisms by intervening in their metabolic processes. The first antibiotic, penicillin, obtained from the mold Penicillium notatum, was discovered by Alexander Fleming in 1929. The industrial production of penicillin involves the development of a large-scale fermentation technique. The original microbial strain used by Fleming, however, gives poor yield of penicillin in industry. Therefore, another microbial strain, Chrysogenum, and its mutant is used in commercial production. So far, at least 6 natural penicillin have been isolated. After that, types of antibiotics. The antibiotics can either be bactericidal or bacteriostatic. Penicillin is very effective drug for pneumonia, bronchitis, sore throat, and other infectious diseases caused by various cocci and some gram-positive bacteria. Another widely used antibiotic is cephalosporin, which is isolated from the species Cephalosporium. Both penicillin and cephalosporin are commonly referred to as beta-lactam antibiotics. The full range of microorganisms attacked by an antibiotic is called its spectrum. Broad spectrum antibiotics are effective against several different types of harmful bacteria, and chloramphenicol is another broad spectrum antibiotic isolated in 1947. It is rapidly absorbed from the gastrointestinal tract and hence can be given orally in case of typhoid, dysentery, acute fever, certain forms of urinary infection, and pneumonia. Certain antibiotics are specific for certain diseases, for example, streptomycin for tuberculosis, chloramphenicol for typhoid and pneumonia, and dihydroxyzine is supposed to be toxic towards certain stains of cancer cell. Thank you. That's all from my side.